Good afternoon, everyone. We are so happy that you could join us for today's webinar with the Black Doula Consortium. This is the second series in our webinar series, and today we will be discussing the groundwork for person-centered care, and we'll be speaking specifically about SB65 and SB464. On today's agenda, again, we're going to talk a little bit about our partners in this work, provide a little bit of historical context about why we're here, talk a little more about the consortium, and then dig a bit deeper into SB65 and SB464. So my name is Shantae Balch. I am the president and CEO of Black Wellness and Prosperity Center. We are a CBO launched in the Central Valley to unapologetically meet the needs of Black women and babies here in the Central Valley and beyond. And we really are a catalyst to improve the well-being and prosperity in the Black community. That's really our primary goal and purpose. So the Black Doula Consortium is a partnership between the center at the Sierra Health Foundation, Blue Shield of California, Black Child Legacy Campaign, Black Wellness and Prosperity Center, and Adjua Jones. And so we're all working in partnership really to come together to reach our community, to really center this work around doula care. And we have a goal of reaching a wide audience. And so we'll have varied topics throughout the webinar series. So just a little bit of context in terms of why we're here. You know, we really are facing a Black maternal infant health crisis across the nation. We're well aware of the fact that, you know, in the United States being one of the most developed, richest nations in the world, but even still, Black moms are dying at one of the highest rates. And so, you know, we have data that tells us that Black women are 3 to 4 times more likely to die from childbirth. And we are a very small percent of the California population, about 5% of the pregnancy cohort, but we make up about 21% of pregnancy-related deaths. So definitely a huge disparity there. And so we really, Black Wellness and Prosperity Center has a specific vision around that, which is no Black woman will die from a preventable childbirth related death, no Black woman will deliver a preventable preterm birth, and no Black baby will die from a preventable cause. So a little bit about the approach with the consortium. We're really highlighting the systemic and root causes of this crisis. We're really wanting to build a stronger community-based infrastructure under the leadership of Black maternal health experts, and really prioritize unbiased, culturally congruent, person-centered care. And so that's what we're here to talk about today. That's the key agenda items. And so our consortium goals, one, we want to strengthen and promote California's Black Health Equity Network. We really want to listen to and lift up Black voices. We want to increase access to information and resources. And 4, we really want to target key stakeholders and decision makers so that we can inform and influence policies and practices that impact Black women and babies. So today we have 2 amazing webinar speakers. We'll be hearing from Adjua, who's a doula and Black maternal and infant health advocate. She's also one of California's public health leaders. We'll also be hearing from Onyema, who's a policy analyst with Black Women for Wellness Action Project. And so before we get started, I wanted to just mention that we do have a survey posted. You can see the link on your screen, but we really want to know how you feel as a Black woman. How will SB65 and SB464, how do you feel it will support you as a Black woman? So again, you can see the link to the survey on your screen. So we will have Adjoa, who's going to present SB 464 and a little bit about Adjoa. So she received her BS in Health Science and Healthcare Administration from CSU Dominguez Hills. And she most recently completed her MBA in Nonprofit Management at the American Jewish University. She's a certified lactation education specialist, and she's a doula. She currently serves as the African American Infant and Maternal Mortality Outreach and Engagement Director of the Division of Maternal, Child, and Adolescent Health. And she's worked within Department of Public Health and Department of Health Services for the past 24 years. She recently completed an institute fellowship with Women's Policy Institute. And she also co-developed a doula board motion to improve the health and birth outcomes for Black women and babies locally, regionally, with plans for statewide implementation. So she's received numerous service awards. She's also a proud mother, daughter, sister, and mentor. And I'm very happy to introduce Adjoa Jones.
Thank you so much, Shantae. I'm working, you know, these bells and whistles, working to get off of mute and get my camera up and loaded. And so I want to thank you so much for having me here. Thank you so much for the partnership and the work to present these great webinars and really to focus on the needs of Black women, infants, and the Black family as a whole in our community, not just locally in LA for me and like for yourself in Fresno, but across the state of California and beyond. So again, thank you. Today, I'll be talking a bit about SB 464, our last webinar, our first webinar in the series. We talked about, and I shared with you some of the historical perspectives and our experience of Black people here in America for the last 400 years and how that has greatly impacted our health outcomes, how that's greatly impacted even our social status and our way of living, how racism and the biases have impacted the way in which we're able to survive and thrive. And so what happened, thankfully, SB 464, let's talk and dig into that. SB 464 was authored by our former Senator Holly J. Mitchell. And then also in the writing and authorship of that bill was Black Women for Wellness, Narbese Nana Flint, who is gratefully on her way to becoming a mother shortly as well right now. Her baby is incubating, as we call it, or sitting there lovely, growing and developing in her womb, but very excited about this work. And the purpose of this bill is the bottom line, and what we did when we went out and lobbied was that Black women deserve better, period. And that was one of the taglines around this work. And what this bill was is the California Dignity in Pregnancy and Childbirth Act, which we began the work of going out to lobby for back in 2019. Throughout 2019. And the purpose is to address the birth outcomes, to look at racism and its impact, but the impact at the level in the clinic setting with doctors and everyone in hospitals and clinics and everyone who comes in contact with a pregnant woman from the moment she comes into the clinic, from the moment she takes that test and finds out that she's pregnant. Anyone who comes in contact, the purpose is for them to be educated and trained on implicit bias and racism. And not just, you know, what we're used to in like we're doing now, a webinar series, but an in-person training. So I'll talk to you a bit about that and then talk to you about what does it mean, what was the bill's focus, and what are the issues that we're going to address. Why we needed this to happen is because most time previously even in my experience of doing this work in Black infant health for the early 90s, most of the focus of death rates, maternal mortality and morbidity, infant mortality and morbidity were focused on the mother, or focused on the woman, focused on her family, focused on what she was or was not doing. So a lot of victim blaming and shaming, when in fact we have found out, social scientists, researchers have shown, and it's been proven that racism has become one of the leading causes of maternal deaths and infant deaths, especially for Black folks. In California alone, we lose Black mothers at 3 to 4 times the rate of white mothers, and for infants 2 to 3 times the rate, Black infants 2 to 3 times the rate of white infants. And so what we're finding is that Black women and even infants are ignored when they present in pain. Their pain is diminished, the acknowledgement of pain, or they're treated in a way in which they're either acting, providers act as though they're lying, act as though they don't know their bodies, act as though they're not aware, and don't have real-time good conversations because of the biases and racism and the myths that have been shared with them. And so even here, as we explain implicit bias, Black Americans are systemically undertreated for pain relative to white Americans. More than half of the sample white medical students and residents believe biological myths, such as that we have thicker skin, we have a higher tolerance of pain, and you know that we present differently than any other race of people. Where is that proven? There's no scientific data to prove that. Also, 1 out of 3 Indigenous women, 1 out of 4 Hispanic women, and 1 out of 5 Black women experience some type of mistreatment during pregnancy, delivery, or postpartum, when that should not be so. We know these biases even exist. I'll give you a further example. A lot of times we look at television, and television depicts a race of people in certain ways, especially for Black people. It's been very stereotypical, from pimping to pandering to the Jezebel mentality, or the Mamie mentality, with Black women always either talking loud or wearing these type of rags around their hair, just all these stereotypes. So then when people meet us that are even from other races, they assume that is the way in which Black people, or they assume we're all rapping, we're all playing ball, all of those things that are not true, just like they wouldn't be of any other race. I can't assume that every race of people have come here. You know, even if we look at the immigrant population, not everybody has come here as they deem illegally. And so I cannot make that assumption, but biases that we have developed will allow us to do so. Racial bias has been shown to impact the quality of care. NPR, Nina Martin did, and ProPublica did a study, a series called Lost Mothers. In that series, one of the things she noted is that Black women had, they did a survey, and most of them said, you can just tell, you can feel it when you come in, the mistreatment or the way in which folks have deemed that there's something wrong with you. I give an example, a sister shared with me, Jessica Wade of Mighty Little Giants, how one of the nurses, the mother was presenting at the NICU for 7 months because her child had been born early or very low birth weight, and the child had to be in the NICU for months. One of the nurses had the nerve to come up to her and say, "You're too dark to have a baby that light." How is that relative to anything that's going on with the medical care? Or, you know, issues that have been presented where patients have shown, they've talked to a nurse or a physician about something, and they even had a case where someone tampered with the mother's milk in the NICU. Next slide. So the perceptions have not been untrue. The perceptions that we have perceived when we present are relative. And so when these biases are not addressed, when racism is not addressed, when women walk away, it has been also proven the stress over time begins to build up in the body to become toxic. They call it, one group calls it the weathering experience, that over time your body, it's almost like you're in a constant, like you press the gas on your car and it's continuing to run and you hold your feet there. And that's the process that folks are experiencing in racism, the continuance of such. And it's been proven in studies shown that young girls, Black girls in elementary are starting to experience racism. So imagine from that time, elementary, all up until the time when folks decide to give birth, even if they're in their early teens or as young adults and older women. And so that toxicity has, and that stress has really impacted our birth and health outcomes over time. Next slide. However, implicit biases can be unlearned. So SB464 intends to do that through training and refresher courses at least every 2 years. So the trainings are meant to be in person. And as I mentioned that to you before, the in person is supposed to be where you can, the provider can then engage in practices or type of scenarios and scenes of how they show up or how a client may or patient may perceive that particular interaction or conversation. And so COVID did a real number on us because this was supposed to begin in January 2020 and had to be put on hold, the development even much so of the curriculum and the presentation of such so that they could be done in person. Some folks have been doing the events online or the training series online, but now they have moved to where we may be able to get more into in person and look at the development more so of the curriculum. So what is SB464 in itself supposed to do? One, it requires evidence-based implicit bias training for perinatal inpatient providers in California. They're supposed to be very personal, interpersonal throughout the structure of that health system. It's also to help providers recognize their own biases. So we have these type of conversations to talk about how when a Black woman shows up and says, I'm in pain, and they say they need meds or something, that our Black person, don't assume that they're a drug addict. Assume that they actually have some level of pain, and then also help them and teach them about how you can modify even the use of, if you have a concern about that medication or if it's not healthy for them during their pregnancy. But having detailed conversation as a provider, being able to educate your patients is very important, and having real-time dialogue like you would do with any other human being that presents. The other thing it's supposed to do is improve the death certificate reporting to get more accurate maternal death count. Not every state was required to report, and folks need to know that how we record pregnancy-related death is the first during the term of the pregnancy and a year after that pregnancy has ended, whether it was through a live birth, whether it's through a miscarriage, stillbirth, termination. That is a recording a year after that time. Then also it's to require the publication of maternal morbidity and mortality data, which is stratified by race and other determinants. This is critical for us to be able to monitor not just the death rate by race, but also hospitals and birthing centers are able to be transparent and held accountable. And so that's accountability by the patients and accountability by our community and the providers themselves. The other thing it is to do is to improve, let me move this over a little, improve community. I want to make sure education about ways to report experience of health care associated discrimination. That is very critical. Every provider is supposed to inform their clients, their patients, that they have a right to file a complaint about discrimination, file a complaint about mistreatment, and be able to report and receive a response. Also be able to change and switch their providers. So you as pregnant women need to know, as mothers, as folks in your reproductive life cycle, that you have a right to report and switch your provider. And so this picture here is some of us there. I'm somewhere in this picture in the back behind one of those beautiful afros with our senator, our former Senator Holly Mitchell, when we all went up to lobby and testify in support of SB 464. That was early in 2019. We went from LA, grabbed some folks in Fresno, and met up in Sacramento and spent a day at the Capitol meeting with some of our representatives. Next slide. And so how do you file a complaint? This is really critical for you to know. First, you have to file a grievance or complaint with your health plan. And so here's a website listed here where you can go and file a grievance. If it's not resolved, and it's supposed to be a response or resolution within 30 days, then you can file an independent medical review complaint with the Department of Managed Healthcare. This is California. So if you're listening from another state, you still have this option across this entire nation. Then the other is file a complaint. If that does not resolve, file a complaint with the California Department of Public Health. The other issue with any type of discrimination, whether it's race, whether it's due to your sexual orientation, whether it's a disability, whether it's about housing, this is where you file a complaint with the California Department of Fair Employment and Housing. This includes medical treatment. So if you're not treated fairly. Also, you have a right to file a complaint with the Medical Board of California. Same thing, this can be done state to state. This is critical for Black women because this issue of maternal mortality, morbidity, implicit bias, and racism doesn't have anything to do with your socioeconomic status. You can be rich and wealthy. This happened with Serena, we knew, Beyonce, and there's a number of celebrities that have been talking about their experience, but everyday folks, look up Shalon Irving's story, hear about our sister who propelled some of our federal assembly folk and Congress members to create a California Omnibus Act. The state federal Omnibus Act, which you will hear more about the California Omnibus Act next. So every patient, you, myself, anyone deserves a right to respectful care, care that is with integrity, care where you're treated like a human being, and care that will improve your outcome as well as your infants. So again, thank you for allowing me to be here and present. If you have any questions or need more information, you can find me or email me at adjjones.381@gmail.com or look me up on LinkedIn. Thank you. Thanks, Shantae.
Thank you, Adjoa, for that very, very powerful accounting of the context and the history and how SB 464 is really helping to lay the groundwork for Black women to receive the care that they deserve.
You're welcome.
Absolutely. So we hope that you've enjoyed this webinar so far. We want to remind you that your voice matters. We would like to invite you to complete the survey, which is listed on the screen. We really want to know how you feel as a Black woman. How will SB 464 and SB 65 support you as a Black woman? And this information really is critical for us to know and understand as we continue to advocate and work on behalf of ourselves to make sure that we receive the care that we deserve. So again, thank you, Adjoa. Next, we're going to hear from Onyema, who is going to speak with us about SB 65 California Momnibus, and a little bit of background on the incredible Onyema. She is a policy analyst with Black Women for Wellness, the Action Project. She began her work in reproductive justice as a program coordinator for Black Women for Wellness Get Smart Before You Get Sexy program. It's the comprehensive sex and sexuality education program of the organization's reproductive justice focused projects, which is Sisters in Control. So since then, she has continued her work in reproductive justice in varying capacities, and she currently works on behalf of Black Women for Wellness Action Project to advance intersectional transformative legislation that seeks to secure the health and well-being of Black women and girls throughout California. Onyema holds a Juris Doctorate from Northeastern University School of Law and a Master of Public Health from Tufts University School of Medicine. She is absolutely committed to contributing to the global realization of reproductive justice by leveraging her training and experience in the field. And so next, let's hear from Onyema on SB 65.
Afternoon, everyone. Thank you very much for that beautiful introduction, Shantae. I am certainly trying to grow into, yes, those shoes. But good afternoon, everyone. My name is Onyema Background, and forgive me, I will start my timer just so that I know where I am and so I can keep time. My name is Onyema Background, and I am a policy analyst with Black Women for Wellness and Black Women for Wellness Action Project. And I will be speaking today on SB65. So I hope this webinar finds you well and enjoy, I hope you enjoy our presentation. Thank you very much. Oh goodness, okay. And so before we jump in, I'd like to share just a bit of information and background about our organization. And you'll notice it says Black Women for Wellness /AP. So Black Women for Wellness is the 501c3 wing of the organization, and it's committed to the empowerment, health, and well-being of Black women and girls. And the inception of the organization was the initial program was the Shangazi program. That's how BWW started. And Shangazi is the Swahili word that translates to aunt in English. And it means aunt. And that program paired mentors with pregnant people through, and those mentors stayed with those pregnant people through their birth and up until their child was 1 year old. And so that's how Black Women for Wellness was working on the grassroots before it decided it wanted to work upstream and address systems and all the injustices through policy and a lot of its programming and outreach and education. And so it did start as a pregnant person's mentorship program. And so it established its 501c3 in 1997. And then in 2017 came the 501c4, Black Women for Wellness Action Project. And it is the first Black reproductive justice 501c4. And it's 501c4. And it's the only reproductive justice 501c4 in California. And so I've mentioned the term reproductive justice a few times, so I just wanted to ensure that we all had a common understanding for the term, because reproductive justice is the framework that our work is grounded in. It informs the policies that we shepherd through the legislative process. It informs our programs. It informs our education and our outreach. It's funny, in the public health world, there's a concept called health in all policies. And it's Black Women for Wellness's approach is really a reproductive justice, or RJ, in all policies. That's our approach to this work. And so it's important that we ground ourselves in the definition, which is reproductive justice is the human right to control our sexuality, our gender, our work, and our reproduction. That right can only be achieved when all women and girls have the complete economic, social, and political power and resources to make healthy decisions about our bodies, our families, and our communities in all areas of our lives. And that definition is courtesy of Sister Song. And at the core of reproductive justice is the belief that all women have the right to have children, or to decide to not have children, and the right to nurture the children that we do decide to have in a safe and healthy environment. And Ms. Adjoa mentioned with dignity, and that is critical to this work and to our framework. And that just in this framework gives us the guidance we need as we march forward and seek justice and equity. And so I won't spend too much time on these slides on the current landscape, because we heard previously from Adjoa Jones, who gave a compelling presentation that outlined just the disparity, right? Like the crisis that we find ourselves in, even in California. The maternal mortality rate for Black women is it's disheartening, right? It's it's devastating. And so here are a few numbers, and we've heard from Ms. Adjoa a few numbers, so I won't belabor this, but I do like to share this chart. And I think I like to share this chart, and I juxtapose these two, this graph and this chart on the same slide right next to each other, because yes, California, according to data from 2013, has made commendable strides to reducing its maternal and infant mortality rate, right? And notice that I said since 2013. 2013 is the most recent statewide data that we have. So clearly we need some more up-to-date data published. But in 2013, between 1999 and 2013 is the chart on the left, right? And it's a comparison between California rates and the United States. California is in the blue, and you can see that California is faring much, much better than when compared to the country. Now, the graph on the right show or illustrate or depict maternal mortality rates by race and ethnicity in California on the bottom in that same period between 2011 and 2013. And on top of that, you have the infant mortality rates by race and ethnicity. Now, in red, right, for both the infant mortality and the maternal mortality is Black folks, right? And we have, the maternal mortality rates, right, for Black women in California was 26.4 per 100,000 live births, as compared, to our counterparts. 6 times the rate, right, in this period. And so that's jarring and that's devastating. So we can look and see, yes, California has made great strides, but we can't rest on our laurels, because there is still work to do when it comes to Black women. And Ms. Adjoa, beautifully laid out the reasons, right, why Black women are in this crisis, right? And so it's imperative that, we do the work to get, and by we, I mean like California, and our elected officials, folks do the work to do better, right? And so yes, and so this slide actually just shares the landscape of midwifery in California. California is honestly heading towards a maternal health crisis, with critical shortages in maternity providers predicted for 2025. As a matter of fact, at this moment, at least 9 counties in California have absolutely no obstetricians, absolutely no OBGYNs. And so California only has 2 nurse midwifery programs in the entire state, and only 1 direct entry midwifery program approved by their respective boards. So it's becoming increasingly difficult for these programs to expand their midwifery workforce. And we know that, midwives are essential to the birthing process. We know that they provide high quality maternity care, and they're cost efficient. Even though I hate talking about cost when it comes to our health, because our lives are invaluable, it makes the most sense to invest in midwifery workforces, and we'll talk about later doulas, to assist pregnant and birthing people through this process, so that we can have better maternal health outcome. We can improve our maternal health outcomes. Okay, so Black Women for Wellness works, shepherds and leads and sponsors many pieces of legislation. And I wanted to highlight 3 of them, which have been our policy responses to the maternal health crisis, or the maternal mortality crisis in our state. Adjoa Jones again gave a compelling presentation on SB464, and I will in any moment now talk about SB65, forgive me. And but I do want to give an honorable mention to SB1237, which removed the physician supervision requirement for nurse midwives to practice. And this, recall that there are at least 9 counties and counting, right, that have no OBGYN. With the requirement to practice under physician supervision, midwives were stuck with physicians, right? Right now, they were tethered to physicians in order to practice. This bill actually allows for them to practice independently, which can expand access because they can now reach these areas that are underserved and deserts. Okay, so to the main show, right? SB65. This is a bill authored by Senator Nancy Skinner, and Black Women for Wellness is leading the charge on this. Authored again by Norbese. You know, significant components were authored by Norbese Flint as well. So she's been holding the mantle. And so the goals for this are to improve perinatal outcomes, close racial disparities gap in the maternal and infant mortality and morbidity, right? And improve data collection and research on socioeconomic factors that contribute to negative birth outcomes. And so here I have a long list, right? Of, in its initial iteration, SB65, you know, the goal was lofty, you know, it's a omnibus. It's called a momnibus, right? It's a play on omnibus for a reason. We were being bold and courageous in our asks, right? But not only courageous in a frivolous way, we really were asking for meaningful, responsive interventions that would address the, you know, the crisis that we find ourselves in. And so here's a list of, here's a list of the components or what the bill would do, right? It would, for instance, it would extend postpartum Medi-Cal coverage from 60 days to 12 months, right? And that is really important, right? Because this is a critical period, the postpartum period. And California is in fact seeing a rise in pregnancy-related deaths during the late postpartum period, which is between 42 days and 1 year after delivery, right? And according to the Commonwealth Fund, among Black women, a greater proportion of deaths occurred in this period, the period between 43 days and a year after giving birth, compared to white women. And so we also know that, you know, Medi-Cal covered 45% of hospital births in 2017 in California. In the United States, it covered 45% of births as well. And 66% of all births to Black birthing people was covered by Medicaid. And so extending postpartum Medi-Cal coverage really actually reaches a significant population of Black birthing people. And so this is a really good thing for continuity of care and, you know, so that we can catch any latent issues that arise and prevent these very preventable deaths. It also mandates Medi-Cal coverage for full spectrum doula care. And that is phenomenal, right? Like, because those who have typically had access to doula care have been those with means. And so, you know, by making it a Medi-Cal benefit and ensuring Medi-Cal coverage, it means that full spectrum doula care is now accessible to all communities, right? And if 66% of births in the Black birthing community are covered by Medicaid, then this is something that increases access to a significant population of Black women. And, you know, studies support what we as a community have understood for years, that doula care helps to improve birth outcomes and reduce complications in birth. And so I think, you know, this is a critical ask, and it's something that I'm excited was included. It would provide guaranteed income for low-income pregnant people, codify and expands the California Maternal Mortality Review Board, and also prescribes the type of data they should investigate as well as publish, right? And actually publish data, because we haven't seen anything since 2013. And so if we don't measure it, how do we know where we really stand? Because we know based on county-wide data that the maternal mortality rates are in fact increasing. We know in Fresno, we know in Los Angeles, that as a matter of fact, we are in a crisis. And so we need to measure, you know, so we understand our situation, but we also need to measure so that we understand whether or not the policies that we are proposing and implementing is actually effective. And so I think that's a really critical piece. I'll move on just for the sake of time. And so the current status of the bill, we are excited to share that we have garnered some really amazing budget wins, right, for the state of California. So anticipated to be included in, actually, but it has been, it just needs to be signed, included in the governor's budget, in the state budget for 2021, are guaranteed income pilot program that prioritizes pregnant Californians so that they have funds to pay for items that they need, right, for during their pregnancy, and other costs. Medi-Cal coverage for doula services, which is very, very exciting. Again, this was something we asked for. This is something that got in the state budget. Now we have to work with them through implementation, and I imagine we'll talk more about that later. Extended postpartum Medi-Cal eligibility. So again, in California, initially only pregnant people who were diagnosed with a maternal mental health issue received Medi-Cal postpartum extension from 60 days to 1 year. But now all birthing people postpartum receive this care, are eligible for extended postpartum Medi-Cal, under this. And so it increases the CalWorks pregnancy supplement. Women were getting $47 a month. The supplement has been increased to $100, and they get earlier access to CalWorks for pregnant people. Now, the bill is robust, and so there's still more. Even though we have these amazing wins, the rest of the bill remains, and it's continuing through the legislative process. Currently, the legislature is on recess, but but once the legislature comes back, the bill will be heard on the assembly side in the appropriations committee. And so as we move through the legislative process, these are things that we are still pushing for, still looking to update and remove the burdensome CalWorks requirements for pregnant people, such as like welfare to work requirements, right? Sure, if pregnant people still want to opt into it, they're more than welcome to, but they should not be required that should not be a requirement for eligibility to gain these CalWorks benefits. Housing assistance for households with pregnant people, we're still asking to codify and expand the California Pregnancy Associated Review Committee, and to update the fetal infant mortality review process to better collect data and prevent future deaths. Again, we need to be able to measure. We need data to get an understanding of where we really do stand so that it can inform how we move forward, right? Also, again, remember we talked about how, not only are we experiencing maternal or maternity care deserts in California, we don't have the capacity, midwifery programs don't have the capacity in this moment to train culturally congruent midwives, right, that can provide maternity care services in this moment. So we're still looking to build midwifery workforce and incentivize recruitment and admission of people from underrepresented and underserved communities into these programs so that, we can have culturally congruent and cultural concordance in the care that is provided for our mamas. And yes, so and I just have some final comments. Just Black Women for Wellness has worked on maternal health since its inception, and we've been sponsoring legislation around maternal health equity for the last 10 or so years. But policy has been a critical strategy for us, and because of the widespread systemic and structural change. And so do note that we engage community members in our policy work, and pre-COVID we have taken, you saw in Adjoa's presentation, 80 women at a time to the state capitol to committee hearings. Why do I say that? I say that to encourage you to plug into our organization, check us out, see what we're about. If you'd like to find out more information about SB65, if you have any questions, this is my email address. Feel free to email me, contact me. The website is right below that, so you can peruse our website and just plug in where you can so that you can become involved. And I really am grateful. I apologize. I must have gone over time, but thank you very much for the opportunity to share about this work that we're doing. I hope this was useful in some way.
Thank you, Onyema, so much. That was an absolutely beautiful presentation. And no, you did not go overtime. The topic that we're discussing today is really just so critical in our community, and it's so important for Black women, for Black birthing persons, for Black advocates to really have an in-depth understanding of the groundwork that's being laid to improve the way we experience reproductive justice, the way we experience birthing our babies. And so we could take, the whole day and probably still need more time. So that was really powerful. Thank you so much for really providing not only an overview, but also specific examples. I think it's also really important to talk about the legacy that Black Women for Wellness has created in terms of their work around legislation. It is really just an honor to be able to work with so many dedicated soldiers in this work. So again, we really thank you for your time today and for your presentation. And so with that, I know that we've mentioned the survey previously, but we want to remind you that your voice is very critical to this work. It's very important, and we want to make sure that your voice is heard and it's lifted up. We really want to hear from you about your understanding of SB65 and 464, and your understanding of how you feel as a Black birthing person, as a Black woman, how these bills will support you. So again, the link to that survey is on the screen. And so next, we are going to spend a little bit of time on some Q&A. I am going to just have some discussion time with Onyema and Adjoa, just so we can maybe sort of understand with all of this groundwork that's been laid. I think it's important also to sort of talk through, what are the barriers, for example, in SB65 and SB464, what's missing, and some maybe more examples so that we can make sure that our audience really understands from a practical standpoint, right, how 65 and 464 will benefit them specifically. So I know that, we've given a few examples of that already, but just, I'm gonna start with you, Adjoa, with SB464. Can you share two concrete ways that you feel that SB464 will support Black birthing persons in California?
Well, I believe, and it's the conversation that I've had, a colleague of mine, Diamond Lee, and I have done some presentations, for example, with Kaiser West LA and their South Bay offices with their physicians. And they actually were very encouraged by the share because it led to some of the conversations around the work I've done with the county on the community action teams and the impetus for creating a space for Black people, Black community leaders, parents and fathers, mothers, grandparents, as well as our faith-based community and community leaders to come and talk about and address strategies to in this crisis, this public health crisis, mamas and babies dying. And so in these conversations and these presentations or trainings, we've had the opportunity to really explore what it feels like for Black women when they present and they're ignored when they express their pain. What it feels like when we have young women like LaShondra Hazard, who presented at a facility on the East Coast. She was in Boston, and she said, "I'm literally dying right now." She expressed that she was in so much pain from some pain in her side and in her stomach, and she was probably about 3 to 4 months pregnant at the time. And my count of that may be off. But the point was, she went kind of on her Facebook page and people said to her, "What's going on?" And she said, "They're basically saying there's nothing wrong with me, that, you know, there's nothing wrong with me at all. That's just the baby growing," or they couldn't identify or would not identify a problem. By that evening, LaShondra and her unborn fetus had passed. Those are the issues that are critical. We had lots of stories. Amber, I want to say, there were a few women on the East Coast who passed, but we have another sister in Antelope Valley who presented in to deliver her son. And sadly, that family lost her. One of the issues was it appears she had a reaction to something that they gave her during labor. And I don't want to say the wrong thing right now, but whatever they gave her during labor caused her to go into, she started to, I think, have seizures, and looks like possibly end up having a heart attack. But it left her mother, who was her foster mother or adoptive mother, to care for the baby along with the father of the child. And what was critical was that father could not get the baby for a period of time because he was not her spouse. But he was the baby's father, so he had to go through that process with DCFS and everything. And there was some biases shown there. And so what we're talking about is having folks look at, you took an oath to serve folks, not based upon the color of their skin, but as a medical provider, when someone presents in pain and has issues, or just presenting pregnant, which is a natural occurrence for everybody in the world, every woman has generally there's a possibility. Now, I won't say that because there's some women who are barren, or there's some women who've had challenges with delivering, and men who are not able to successfully get someone pregnant. So I don't want to put that as what is, what we know exists and say that's not an issue too. But I do want to stress that when it comes to care, it's imperative that we are able to be treated fairly, with equity, with dignity, and not counted on what you feel we're doing, not counted on what you feel is our work life. Even in the Expecting Justice, there's a flyer or infographic sheet on SB464, and they talked about, one of the women said that, "I remember one of the nurses being like, 'You should have thought about that.'" And she's like, "Yo, whatever the hospital name is, that's just not cool. I should have thought about what was the comment? What was the purpose of, what should she have thought about? And if there's something that she should have thought about, give the detail to that, why that's medically important. If you have concerns about someone's personal outside of that pregnancy realm, then if you feel empowered enough to think it, then maybe you should ask it with some dignity and respect. But it's a lot of things that happen, a lot of conversations that clients or patients get to overhear, nurses talking about them, physicians talking about them, and not to them, talking down, making various assumptions. We've had doctors and nurses who've shown up out of uniform that get treated the same way because they're Black. Mm-hmm. So that's why it's critical. That's why SB 464, just the title in and of itself, California Dignity in Pregnancy and Childbirth Act. We have the right to give birth. We have the right to thrive. We have the right to survive. We have the right to the same care and services. And this is just not for women who have Medi-Cal or, who have public health, are in public health plans. This is for private. This is for those who pay out of pocket. That should not be the case. You took an oath to serve, the Hippocratic Oath, serve with respect and dignity as you would if you were on the other side.
Exactly. Thank you so much for that, Adjoa. Thank you for sharing those very powerful stories and examples of how SB 464 will help address some of the very real experiences that birthing persons are experiencing right here in California and in the nation. Onyema, thank you. Yeah, I'd like to open it up to Onyema now to talk a little bit more about SB65. And first I want to hear from you in terms of how do you feel SB65 will benefit you personally? And then if you could share a little more in terms of the relevance of SB65 and building out our Black Doula network. What are some of the concrete ways that SB65 is going to help us achieve more culturally congruent care?
Wow, yes. These are really, really poignant questions. Certainly thought-provoking. To think about how SB65 would help me personally. So I'm of an age, certainly, where I'm at that age where I'm surrounded by friends who are, giving birth, who are getting pregnant and giving birth. And, I hope to become pregnant, one of these days. TMI, y'all, but, we're all, so I'm at that age.
Okay, we're all in this together.
We're all in this together, right?
Absolutely. Absolutely.
So I really am, I really think seriously about birth, about giving birth, right? I have witnessed the births and the birthing experiences of some of my friends, most of whom are Black, right? And I have a personal account of my friend. She still calls me till this day, and she FaceTimes our miracle because, she FaceTimed me a couple of months ago because he was born at 1 pound and, had to spend months in the NICU and spent Christmas, New Year's in the NICU, came home around her birthday, January 8th. And so after that, we celebrated every milestone. She would FaceTime me when he got to 11 pounds, just so we can celebrate that milestone. And so these stories are very real. And we know that poor birth outcomes affect Black women, regardless of education, regardless of income, regardless of any other factors that mitigate the maternal mortality rates for within other races. That's not a factor for us, right? That's not a factor for Black women. So it's imperative that we have policies like SB65 that really, SB65, and I'll say 464 too, that really work to change and shift how care is delivered in our country, right? Because I plan, I am a citizen of the United States and I plan to give birth here, and I hope that my birthing experience will be uneventful. But I work in this field and I have access to this data. And I have access to personal experiences, right? I've watched my friends and I've supported them through really difficult experiences that, the pregnancy is supposed to be, the movies tell us pregnancy is supposed to be this blissful experience. And even if it's not, you're supposed to come through it, right? 40% of these deaths are preventable. So they should not be happening. Right? They should not be happening. That is egregious. And so bills like SB65 do work to really shift how care is delivered, how we think about care in California. And that certainly impacts me because I plan to give birth here. And I'm hoping that at that point, I will encounter a healthcare system that is cognizant of the issues that I will face, right? I will not be ignored, that, I will have access to the care and the services that I wish and that I hope for, that will support me to deliver, a healthy baby when that happens, happens for me, right? I'm claiming it when it happens for me. So
yes, claim it, claim it, claim it.
Aja was like, I'm ready to be an auntie. No,
yeah.
You know, so I know that that's not concrete, right? I know it's not speaking to how, you know, doula care as a Medi-Cal coverage will benefit me, right? It's not speaking to how, you know, postpartum, extended postpartum eligibility for pregnant and birthing people will affect me personally. I can't speak to that yet, you know, but I'd hope that in the event that I needed those kind of resources at the time that I give birth, that it'd be available to me. So that again, it goes back to this issue around dignity, such that I can give birth, right, in dignity, regardless of my income, my quote unquote status or socioeconomic status, right? We want to create an environment where everybody can safely give birth with dignity, right? And have the access to the resources necessary to support that. So vague yet.
I think it was very concrete. I really appreciate you sharing your personal thoughts and feelings, and also your potential birth journey. With us here today, thank you for sharing. So I want to thank you and Adjoa for the very powerful presentations that you made today. The information was relevant, timely, and I believe really sheds additional light and clarification on both SB 464 and 65, and how these two bills are really in California helping us to lay the groundwork for better birthing experiences in our community.
Absolutely. And Shantae, yeah. I want to say this real quick.
Sure.
I want to thank you too, and thank you, Onyema. I heard you calling me out, and I really appreciate that. And like Onyema shared, the Shangazi program, I was one of the first to go through the training with Black Women for Wellness when they were doing the Shangazi program back in the 90s. And the imperative around that was, like Onyema said, so that we can ensure young Black women had someone to support them, that auntie perspective, which is very similar to the doula, partnering up and mentoring a young woman who was giving birth and going into the pregnancy phase and parenting phase, and how we would support, how we celebrate. We see so many other women in various cultures being celebrated in their pregnancy. Do we know if people are questioning them behind the scenes? We don't particularly know that, but we know that there's been a lot of shame placed upon Black women, especially if they're single and parenting or deciding to give birth. And we do not want that. We want to just honor the pregnancy. If a person wants to be a parent, a mom, a birthing person, we want to uplift, encourage, support, surround them in love with our village concept. And so that's what Shangazi was. So even Executive Director Jan Robinson Flynn, who Onyema works for and who I've worked with, it was, this is the work, and the impetus is to ensure that Black women have the same opportunities afforded them by anyone else. The same in what our former Senator Holly Mitchell has done with this bill. Similarly, we could talk about the Crown Act. Is we're dealing with identifying racism and its impact. And even with the Momnibus, it is a development similar to the federal Momnibus that was done by Congresswoman Alma Adams and Lauren Underwood. And Lauren is a nurse and also was a friend of Shalon Irving, who worked for CDC, who was doing the same type of work we're doing to address the traumas that we have faced in our communities around issues of race, racism, implicit bias, issues of mistreatment in care, post-traumatic, I want to say slave disorder, but it's more than that. And so that is why we're doing this work. That is why you're doing this work, Shantae. And so again, thank you so much, ladies. Onyema, a great presentation on SB65, excellent, and the work that you're doing. I'm empowered to see you go from MPH student to get your JD and now be out here analyzing these policies and creating policy work. So again, thank you so much for having us, and I'm looking forward to the work we're going to do to encourage Black women, to encourage Black families, that there is still hope. You're right. Look up CDC, 50,000 near preventable issues occur every year for pregnant women, not by color, but all women. But it's Black women and babies who are dying at the highest rate. And that's why we have to have this focus, because when we get better, everyone else will get better in the system and in these structures. So again, thank you.
Thank you both.
And that was a drop the mic moment by Ms. Adjoa, but I do have to say that she is an inspiring force who is just someone, gosh, just an unbelievable force in this work. And so I'm so grateful for her guidance and mentorship in this. So the work that you do, Ms. Adjoa, like, you are a phenomenal woman and a gift to this world. So thank you for everything that you do as well. And thank you for having me, Shantae.
Absolutely. I couldn't agree more. Thank you both so much for joining us. And I'm looking forward to the journey with you both. So I just want to remind our audience again that you have joined us in our second series for the Black Doula Consortium. Our next webinar is scheduled for August 31st. You can schedule the webinars. The social media handles are listed there on your screen, so you can follow in those two places. Just a little bit more about the Black Doula Consortium, and you can, at your leisure, take a look and read a little more closely about the consortium. And I would like to close out by again thanking all of our partners, Adjoa Jones, the Center with the Sierra Health Foundation, Blue Shield of California, Black Child Legacy Campaign, and Black Wellness and Prosperity Center. So again, we thank you for your time today. And remember, when we have healthy neighborhoods, we have healthy women, and we have healthy babies. And when women are healthy, their neighborhoods are healthy. Thank you so much for joining us, and we will see you next month.